Yeah. We do a couple of these. Yes. These are the dominant binders. And these are the tourniquets. And we do the handshake.
We do the handshake. Great.
Yep.
Yes.
Yeah.
What you pay attention to is the anterior superior press, right here. Alright. Pass that under the patient. Obviously, if they're big, you could fold it. Right. What you want to do is bring it around so it comes up front. Using. Yeah. So that's good. We will put that right around. Here for the piece. You don't want it too close because you're gonna put the Velcro. You're gonna put the Velcro piece down. Right? Very, very simple. Put the Velcro pieces up. Alright. Okay. Then you take this. Alright. And you can adjust this however you want. You can pull it as tight. Let me know if it hurts. Alright? But what you want is to make sure your fingers can fit. You want it too tight. Especially if you're gonna leave it on for greater than 24 hours. Because yeah. Because it can cause necrosis, it can break down the skin. So what you do here, when you come back, you go down, you just literally rub it, you secure it there on the patient, like this. Alright? And then bring it. Okay? So this is called a T-pot. And again, you really don't have to cut it. And you can keep using it. But what you do is fold this. If you want more pull, you fold this part as further as possible. So you pull this as tight as possible. So for the immediate transport, you really don't have to pay much attention to that rule of the fingers. Because when you get the patient to the hospital, they have to know if they're going to keep it on to make sure that you can at least, put some fingers in there or at least put a pad, gauze, protect the pressure points. Because if you leave this beyond 48 hours, you're going to have tissue break. You're going to have to start having tissue break. But somebody with a bad pelvis, especially if somebody you have to evacuate out of the island, this saves lives. I can tell you that because we use a lot of this. And again, especially if you understand the mechanism of injury, if it's an anterior posterior type injury, you have what's called an open pelvic. Pubic bone just comes apart. That's what you need to bring it back in that period because that patient is not pouring blood into that pelvis. If it's a lateral, that's a little different because the bone is going in, but what that does, it increases the volume, pelvic volume, so you can have what's called tamponade, so the bleeding can potentially slow down and stop, save a life by doing that. Very, very simple. So again, you just do the reverse, take it off, right, and release it. And sometimes you can release it and just leave it on the patient. Again, you guys don't have this in the field, but you have so many of these back home. You just leave it on the patient in the hospital for 24 hours like this. If the pressure drops, you pull it back up again. Things like that. So very, very simple device, guys. Okay. And again, there you go. All right. It's not that difficult. All right. All right. T-pot. Oh, it's an O. Okay. Yeah. Transpelvic occlusive device. And there's different companies that's predominantly used in the US. Alright? Cool?
Yes, okay, man.
Thank you very much. Thank you very much. So the time is very, very important, especially if you want to save the room. Yeah. Alright guys? Hey man. Yes. SMA, smartest man alive. You know what's interesting? I saw 3 kids walking down. I said, smartest man alive.